Thank you for joining us for another informative, educational, and entertaining edition of Music and Medicine with Dr. Charles Modlin, kidney transplant surgeon, board-certified urologist, public speaker, and well-known community national leader for the elimination of health disparities, dedicated to informing you, the listening audience, about important health topics and health information that you, your family, and your community need to know, while at the same time providing you with quality entertainment, because music and entertainment is medicine. Dr. Modlin's co-hosts are Jerome Brown and registered nurse Jonathan Branch, and the program often includes special content expert guests. So, without further ado, here is the host of the show, Dr. Charles Modlin.
Hey there, how's everybody doing this wonderful spring evening? I'm Dr. Charles Modlin. I'm a urologist, kidney transplant surgeon, health equity advocate, and we have a very special program tonight, this evening, on the topic of Alzheimer's disease, Alzheimer's dementia. We've actually aired a previous show on Alzheimer's dementia on this platform, but I thought it was very important that we continue to revisit this topic because it's a very important subject matter. Our special guest today is Mr. Mike Moscarino. He's the board chair of the Cleveland Alzheimer's Association, and he's going to come onto the platform and give us a lot of information about the work that the Cleveland Alzheimer's Association is doing, not only for individuals living with Alzheimer's, the patients themselves, but also the caregivers. There are a number of important opportunities that the Alzheimer's Association can connect individuals living with Alzheimer's disease and their caregivers with important resources. As I mentioned before, my own father, Charles Modlin Sr., was afflicted with Alzheimer's disease, and I, as a physician, knew certain things about the disease, but as a caregiver, I was one of his primary caregivers. He lived with me for several years. I understand quite vividly and personally what caregivers go through. So I want to go ahead and bring on my co-host, Jerome Brown, to see how Jerome's doing this evening. How you doing, Jerome?
Hey, what's going on, Doc? How you doing?
You're looking good. I have a surprise for you.
I don't get surprises much, so I like them when I get them, you know?
It's you don't really like my jokes. I'm not going to tell any jokes.
Before we do anything, please don't. No Cleveland hate, Doc. No Cleveland hate.
No. Here's my surprise.
What you got? Drum roll. Oh, another family member.
So this is Chloe.
Chloe, we have another co-host. You trying to get rid of me, Doc? I see what's going on.
Yeah, she's a rescue dog. She's my daughter's, Hannah's rescue dog. What do they call it? A comfort dog or whatever?
Yeah.
She's Chihuahua mix. I don't know, some kind of mixture or something.
I work for cheap. She worked for treats.
Yeah. She's you may hear her bark, everyone. She's 10 years old. She doesn't look. She's so small, people think she's like a little, puppy or something.
10 years old, though, huh?
10 years old. Yeah, she was kind of abandoned by her previous owners, so we've had her maybe, I don't know, 2-3 months, something like that. Say hello, Chloe.
What's up, Chloe? One time for Chloe.
So let's see. We're talking about Alzheimer's disease today. Okay. I'm going to see if she'll just sit here. If not, I'll kick her out of the room. We're going to show a very important video. We've shown it before, but I always want to revisit this of my father, some of the experiences that he went through. He was a national senior Olympian, but it's a very moving video that we're going to show near the end. We're going to actually have some videos at the end also that present a lot of very important information on what are some of the 10 signs of Alzheimer's disease. What can you do to prevent Alzheimer's disease? What are the 5 stages of Alzheimer's disease? And, in general, what is Alzheimer's disease? There are several different types of dementia. The most common form of dementia is Alzheimer's dementia. What I wanted to do also is mention that there are disparities in the incidence and outcomes of Alzheimer's disease in African American populations. One of the responsibilities of this program, as you know, and you've been with me from the start, Jerome, I appreciate it. Russell Johnson, our producer, K-Hawk 2 Productions. One of our responsibilities is to educate all individuals, but also the Black community, about important disease states that they need to know about. And Alzheimer's is one of those conditions. African Americans are approximately 2 times more likely to develop Alzheimer's disease and related dementias compared to their white counterparts. Specifically, studies indicate that about 14, this is a wide range, 14% to 500% higher prevalence rates of Alzheimer's exist among African Americans compared to whites. There's a disparity oftentimes in diagnosing Alzheimer's disease. African Americans are often diagnosed later in the disease progression, while they have a 35% lower likelihood of receiving a diagnosis of Alzheimer's and related dementias compared to whites. They typically present with more severe cognitive impairments and comorbidities upon diagnosis. There are various treatment options for Alzheimer's disease. We actually, there is no cure as of the moment right now for Alzheimer's disease. There are clinical trials that are important, but sometimes, and we've talked about the social determinants of health, lack of access to care. Many African Americans don't have access to care, health insurance, the ability to get to treatments. Many individuals don't have the same health literacy. These all contribute to poorer outcomes. And again, I can tell you, I'm as a physician, experienced staff physician. As I said, my father was afflicted with Alzheimer's disease. I didn't know who to turn to. I didn't know how to get support. We wound up putting him in adult daycare.
Yeah.
I'm very grateful, to Judson and other places. It allowed me to continue working as a surgeon, and I knew that he was getting fed and being taken care of, during the day, but put a lot of strain on myself and my family. So we wanted to touch on, again, that's why we're going to have Mike Moscarino joining us. But also I've done some reading, and a lot of times caregivers, again, I was the same way initially. A lot of times caregivers don't realize that it's okay to ask for help. Individuals think they should be able to take care of their loved one. And again, it depends on the severity of the stage of Alzheimer's their loved one has. But, caregivers have to focus on maintaining their health and wellness to be able to take care of their loved one. And so I've looked up, and it says, here are some ways you can care for yourself. Ask for help when you need it. Join a caregiver support group. Take breaks during each day. Spend time with family and friends. Keep up with your hobbies and interests. Eat healthy foods. Exercise as often as you can. See your doctor on a regular basis. And here's an important one. Keep your health, legal, and financial information up to date. And if you have a loved one who's afflicted with Alzheimer's, you need to start thinking about advanced directives and that kind of thing, hopefully before it progresses to where they can actually participate in making some of those own decisions. So with that in mind, Jerome, are we ready to bring in Mike Moscarino, board chair?
Yeah, because I'm sure that he has some more concrete evidence for us and some valuable information.
Oh yeah, very much so.
Everybody would need to know,
And one thing I actually joined the Cleveland Alzheimer's board. I was officially inducted, I believe, last December 2024. And again, there's a lot for me to learn. But yeah, let's go ahead and bring Mike onto the platform. Hey, there he is.
Mike,
hey, good. Chloe says hi also.
All right.
Yeah.
And Mike, he's trying to get rid of me, Mike.
Yeah.
So,
I didn't know all my co-hosts we were going to have. So,
yeah.
Canine co-host. That's good. That's good. So, yeah, thanks for allowing me to join. Looking forward to a good discussion. You covered a lot there, Dr. Modlin, but just can give you some just some basic statistics about the prevalence of this disease. We're almost at 7 million Americans living with disease and 11 million unpaid caregivers. So it's really affecting our population. Another stat that really surprised me when I first heard it is 1 in 3 seniors dies with Alzheimer's or another dementia. Not necessarily from it, but they have it. You had mentioned that it affects the African American population at about double what it does whites, and we can talk some about some of the DEI initiatives that the association has. Just a couple of other quick statistics. It's estimated that last year the disease cost our nation $360 billion dollars in lost wages and people having to quit jobs to take care of people and those sorts of things. So it's really quite devastating both emotionally and financially for people. So,
Mike, those numbers you gave are scary.
They are scary, and as Dr. Modlin mentioned, there's no cure at this point. So we'll talk a little bit about what we're doing in terms of research. There are 2 new treatments that are available, lecanemab and donanemab. Now, what they do is they delay the disease. If you catch it early enough, they're estimating give you another 5 good years, which for somebody facing this what deadly disease is great news, but it's not where we need to be. So the other thing Dr. Modlin mentioned was around care and support. So we have programs where people can reach out to the Alzheimer's Association. We have an 800 number, 24/7, 365. I'll give you the number. It's 800-272-3900. Call day or night for any reason. If your family member is having issues, if you suspect they're having issues, and we've got people on the other line, at the end of that line to help you out. Here locally with our Cleveland chapter, we have care and support groups. So Dr. Modlin, you mentioned, support groups. So at different locations throughout the community, some are virtual, some are in person. And it's really an opportunity for people that are sharing the same experience to come together, commiserate, work through strategies, sometimes just to vent, but to help each other out in working through this devastating disease that they're facing. We also offer education programs as well. Dr. Modlin, you mentioned, how do we get people to recognize that someone has the disease in the first place? And then, what do you do about it? How do you reach out for help? Where do you get resources? We have people on staff as well as volunteers that will help tremendously with that.
How's the enrollment, Mike, as far as participants in these programs right now? Is it low?
The disease is so overwhelming in terms of numbers. We always want to try to get more. And obviously, when you're working with these support groups, for example, you want to keep the numbers fairly small.
Yeah, manageable.
Yeah, manageable, so the groups don't get out of hand. So unfortunately, the demand is there. We rely heavily on volunteers. We give them training in terms of how to give education programs, how to be support team leaders, those sorts of things.
Okay.
So I think that if you look at across the community, we're making a difference, but we want to do more. We know there's more we can do to help people, especially in minority communities, and we can talk about DEI type programs as we go.
I think one of the major messages also, when you talk about Alzheimer's in certain families and communities, a lot of people consider it taboo. When my dad had it, we didn't go around telling everybody, not that we thought it was taboo, but that's family business, that kind of thing. And sometimes when you have your loved one out in public, they may act up, they may have behavioral issues. And a lot of times people, it will reflect poorly on the family when they don't they don't really know that that individual is afflicted with Alzheimer's dementia. And I've told this story before. My dad actually was and again, I'm a physician, I should have known, but my dad was the first person who actually told us, his family, that he had Alzheimer's. Physician, and he wasn't officially diagnosed, but he knew that there was something wrong, and we actually just kind of denied it. Well, you're getting older, getting a little forgetful. But the first time that I really realized it was we were out. He was a national senior Olympian. I think we were in Virginia at one of his competitions, and we were sitting down to order breakfast. He couldn't figure out how to order breakfast off the menu. He was like so confused. Yeah, Jerome, I want to read. We talked about what are some of the early signs of Alzheimer's disease. I mean, they're different. Not every individual will have necessarily the same signs or symptoms, but typically there's a list of 10 early signs. Memory loss, of course, forgetting recent events, conversations, or important dates. A lot of people think that getting old consequently means that you're going to have memory loss, and that's
right.
Not necessarily the case. Difficulty with everyday tasks, trouble managing finances, cooking, completing household chores, confusion and disorientation, getting lost in familiar places, being unable to tell time or forgetting where they are, changes in language, finding difficulty finding words, repeating phrases, problems with spatial perception, misplacing objects, difficulty driving, trouble judging distances, mood and personality changes. My dad actually experienced this in the later stages: increased anxiety, depression, apathy, withdrawal from social activities, poor judgment, decision making, being impulsive, neglecting personal hygiene, difficulty with planning and problem solving. My father had that, and increased forgetfulness and of names and faces. And I've seen situations. I've read accounts and spoken to caregivers. A lot of individual caregivers feel like it's something personal against them if their loved one doesn't remember their name or that kind of thing. And they have to understand that's the disease process. That's not their loved one being disrespectful or forgetting that, who they are and, and what they mean to them, so.
Yeah, them 10 signs sound like things that happen when you get into an argument with your girlfriend. You forget everything. You confuse.
But it doesn't end.
You're like, wait a minute.
Well, you had mentioned, people acting out in public, and that kind of a good segue to one of the things that we do is advocacy, both at the state and federal government levels. So to give an example, we lobby to get a law passed and a regulation in place that first responders every year will get 2 hours of training around Alzheimer's and dementia. So the problem is, if somebody is kind of acting up, law enforcement may think they're being belligerent, they're trying to be violent or whatever. And so the training is really just like how to recognize that that's not really what's happening. Yeah. This person has a disease, and this is the way to try to diffuse the situation. So again, and then at the federal level, we've had a number of increases in research over the past 15 years. We've gone from about 400 million in NIH research to a little over 4 billion. In addition to about 300 million that the Alzheimer's Association directly contributes to research. So that kind of governmental advocacy is really important for a number of different reasons. Another thing we do at the state level is lobby for respite care. So to your point, caregivers get burned out. It's a 24/7 job. It never ends. I know my mom's had the disease for 18 years now, and she's been in Kemper House here in Cleveland for about 4 of that. So the other 14 years we were dealing with her in the home, and having to take the car keys away and all those things. So, having funding that can help provide people with some relief. And to your point, Dr. Modlin, caregivers have to take care of themselves too, too often people burn themselves out, don't take care of themselves. Sometimes they end up passing even before the Alzheimer's victim because they've so neglected themselves. So, and one other quick thing I'll mention in terms of that we have a caregiver relief program. A gentleman named Jan Castora very generously made quite a large donation. We put this program together where if you meet certain financial criteria and you're a single caregiver, that we can get some outside help to come into the house 8, 10, 12 hours a week to give you some break, because again it's relentless. It's a 24/7 kind of issue.
Right. Hey Mike, I have a question for you. What's the age bracket for developing Alzheimer's per se? So is this, is it a young thing or older thing? I mean, what?
Well, I think if you look at the statistics, you would start to see it maybe, in 60s and 70s. Okay. But unfortunately, we see early onset as early as, in your 40s and 50s.
Okay.
There's, a number of stories that we've documented there. So it's, there's some exceptions to the rules.
Of course.
I guess. But, and the problem there is you get, people that, they've got kids, they've got their parents, they're trying to take care of their kids. Their parent, one of the parents is, having issues and gets diagnosed and unfortunately starts on this terrible journey. So, yeah.
And, there's, if somebody has forgetfulness, memory loss, physicians, we don't automatically jump and say that it's Alzheimer's. I mean, again, more likely it is, but I mean, the first thing is to see your primary care doctor so they can rule out any other reversible or treatable causes. You can have vascular dementia, from long-standing hypertension. It could be medication-induced. You could have had, experienced a traumatic situation where, may have some kind of memory deficit suppression. I mean, there are a number of things that could be contributing illnesses, infections and things of that nature. But it's important to if you suspect any dementia, see your primary care doctor. They then will refer you to a neurologist, a behavioral health specialist also. And there are, screenings for Alzheimer's disease. They'll do a metabolic evaluation. So, just make sure you don't automatically assume that it's Alzheimer's disease, and just stresses the importance of having a primary care physician.
Right. Yeah, exactly.
So Jerome, do you know anybody? Have you ever encountered anybody with Alzheimer's before? Alzheimer's?
I think in my opinion, I think everyone has encountered someone or had a family member or a friend with Alzheimer's. I think this is something that affects the whole planet, no matter who you are. And I think that they're aiming towards. Is this saying it has something to do with sugars? Have you heard of anything about that?
Well, there's plaque. Yeah, plaque buildup. There's like different. It can be genetic, hereditary. There's different. I mean, there's research going on to determine actually what the causes are. Mm-hmm. But yeah, a lot of it's plaque buildup. But then there's also, they've done studies. There's not necessarily automatically a direct association. Plaque in your brain, right. Amyloid. There's not necessarily, some people have more amyloid plaque than others and don't have Alzheimer's disease. So again, just Mike was talking about the research and clinical trial. We need more minorities to participate in clinical research trials. We talked about that before. There's a lot of distrust out there. We need to raise the awareness of this disease and how important it is that we participate in these clinical research trials.
Yeah, so it's a good point. One of the 6 pillars that we have for the association is a DEI, and that's really focused on exactly what you just said. That one, there is distrust in minority communities, and you can tie that all the way back to Tuskegee and so part of what we're trying to do is special outreach for awareness and education around the disease. And just it's good timing. On April 27th, we have something called Purple Sunday, and here in the Cleveland area, we're going to have people at over 100 churches, primarily African American, worship services, giving information, having discussion and really just trying to get the word out there of, this is what Alzheimer's and dementia is, that we're here to help. These are the things that we can do to help you out. So kind of step one is just getting people educated. And then to your point, Dr. Modlin, number two is we really are making a strong push to get clinical trials to represent the population. African Americans, Latinos, and other minority groups have been underrepresented. And so when you do a clinical trial and you don't have the proper representation, you're not going to get the results. So number one, get people educated, get them to trust that, yes, I can go in a clinical trial and it's going to be a good thing, and then get them to do that so that we get the proper comprehensive trials and studies done to make sure we get, broad solutions to this disease.
And, most of these clinical trials, it's at no cost to the participant. I mean, a lot of times, they'll offer transportation, access to medications, this, that, and the other. So, yeah, we need to get past, the distrust, because this clinical research is going to be beneficial to, these minority populations.
Yes.
So we have to get past that. You mentioned the DEI, the community outreach. I know Reverend Fred Knuckles is on the board also, and your staff. And I know he's leading a lot of the DEI efforts at a lot of the churches and things of that nature. That's very important. We know nationally that and we don't get into politics on this show, but it's important that we advocate for our ability to continue working in the Black communities, minority communities, and developing programs that are going to allow us to more effectively build trusting relationships and engage these individuals. And it's very important. I know that there's some national pushback against DEI, but when we talk about, from my perspective, when we talk about anything healthcare related, we want to distinguish that from what a lot of people believe DEI is, that is strictly about hiring practices,
Right.
that are not necessarily based on merit. This is about saving lives. We do know that when there's racial concordance on research teams, healthcare teams, and we're not saying everybody has to have every minority needs to have a doctor, physician, nurse that is of the same race. We're not saying that at all, but we do know in many situations it enhances the trusting relationship and a greater willingness for individuals to come in and actually even seek preventative health care, follow, prescribers, physicians, treatment recommendations, compliance, that leading to improved outcomes, whether it's for high blood pressure, diabetes, heart disease, whatever it is. And also just over the past several years, I think even more so in the Black community, it has kind of been taboo to talk about behavioral health issues, depression, stress, anxiety, that kind of thing. But over the past several years, I think it's become more accepted in all communities that we need to focus on our mental health also. Black men typically were macho, we're stoic, nothing hurts us emotionally. We have to get past all that, because as we've spoken before, Jerome and I, behavioral health issues, chronic stress, anxiety, leads to higher resting cortisol, stress steroids in your body. And that can actually cause physical manifestations, higher rates of high blood pressure, heart disease, stroke, kidney disease.
Higher rates of everything.
Everything. Everything. So, it's important. And thank you, Mike, and the organization for continuing, this outreach to the Black community and all communities, because we have to do whatever is necessary to effectively engage these individuals. So, and it takes special dedicated program to be able to reach these populations.
Yes, absolutely. And, you had mentioned about, not getting political, and the Alzheimer's Association is not political at all. Our official color happens to be purple. So red plus blue, right? Yeah, I got my purple on. So that's good. But, when we do talk at the state and federal level, it's really advocating for Alzheimer's, for research, for care and support. That's really what our focus is. We don't get into kind of the rest. And I think people sometimes do get confused when they hear DEI and the Alzheimer's Association. And I think you said it well. the big focus is really on outcomes in terms of clinical trials and that kind of thing, and maybe not as much on some of the more controversial things. So
I read you had a LinkedIn post. I would actually encourage individuals to go to your LinkedIn profile and read your recent post about, how a lot of this pushback can actually complicate or risk, additional funding for research.
Absolutely.
Yeah. Well, we are gonna make noise if staffing cuts and funding cuts are actually starting to have an impact on research. So we're not going to be quiet about that. We're sort of right on the cusp of seeing how that's all going to kind of play out. But our CEO, Dr. Joanne Pike, is already encouraging people in a very polite way, to reach out to our elected representatives to say, hey, we need to increase what we're doing. Please, let's make sure that's what we are doing and not pulling back. We have a lot of momentum, and we want to keep that momentum going.
And the thing is, I guarantee you, Jerome, like Jerome mentioned, it affects everybody, the whole world. I bet a lot of these lawmakers, policymakers have somebody in their family afflicted with it.
Yeah.
Right. Well, and I would be remiss if I didn't put a plug in for one of our big fundraisers, which is a community event, the Walk to End Alzheimer's, which is happening in October 18th. We get about 4,000 plus people together at the Cleveland Zoo, have a short but very emotional and very touching ceremony where people indicate do they have a loved one that's died from the disease or that they're supporting, and we raise a lot of money, but more importantly, we get that huge group, and you just look around at this huge group that's together and realize all these people are going through something similar to you, and there's really that sense of community and energy where people can go from that and be energized to volunteer or get involved in some ways. And sometimes it's just, I'm not alone, because Jerome, to your point, if you talk to someone long enough, somebody they know has this
right now.
Yeah, right. I mean, if it may not be an immediate relative, it may be an uncle or a cousin. I mean, besides my mom, I've lost my grandmother, my mother-in-law, and my uncle to the disease. So,
it's pretty
prevalent in my family. But you talk to people, and you will find that it's most likely touched someone in their sphere of influence. So,
Now, Mike, I have a question for you. Being your position at, with the Alzheimer's Association, what makes you smile like a sense of completion, either every day or every couple of days, as far as the work that you do directly? Like, what's that gratitude? What's that sense of completion when it comes to your line of work?
I think, when we are able to, if I can talk to somebody that is completely at the end of their rope, they don't know where to turn, they're desperate, they don't understand what's going on, and connect with that person and say, first of all, we understand what you're going through, and kind of making that connection, and then being able to help them by guiding them towards medical resources. You mentioned kind of the financial before. There's some practical financial things that you have to plan for, and then bringing them, say, into a support group where they can kind of commiserate, compare notes, and where people support each other, where they've gone from this absolutely losing their mind, desperate situation to, okay, I mean, there's not a cure, but you're part of our community now. We're going to hold you up. We're going to support you, and you bring us together. That's really gratifying to me.
There's a sense of a hug, like, when I got it,
Yeah.
That's good.
You're not alone. You're not alone. That's the message.
We talked about how there's no cure, but I was doing some reading. There are ways to halt the speed of the progression of the disease. And one thing that I read was people need to try to keep their minds active, physically and mentally as well. And it's believed that Alzheimer's is a disease of the synapses, where the nerves connected with one another. And they said it's not about just trying to go back and remember things you've done in the past or old memories. It's actually developing new neurological connection synapses. They said, well, try to learn a new language. Do something different. I mean, do puzzles and other activities that stimulate your mind. Try to engage don't just sit there and watch TV, that kind of thing. Get up,
Right.
Try to get active, eat healthy foods, that kind of thing. And it can halt the progression of the disease,
Yes.
Well, one of the things, doctor, that, we talk about, there are modifiable risk factors and non-modifiable, right? So, there's certain genes that will predispose you more to the disease. There's certain things that, in terms of your environment, that you can't change. But we know, for example, that a heart healthy diet is going to be a brain healthy diet, right? Exercise, eating the right foods. There was a study a few years ago that came out that showed the importance of blood pressure. If you keep that upper blood pressure number at 120 or lower, it significantly reduces your chances. So there are some things you cannot change, but there's a lot of things you can do. And then keeping active physically and mentally is a big part of that too.
I know there are certain, and I'm not up to date on all the different tests to the genetic testing, but I know, I think is it APO, one of the APO proteins, I believe. Some individuals who maybe have a loved one would like to know whether or not they have the gene. But from what I do understand, there's a number of different genes, but even if you have the genes, it doesn't necessarily mean that you're destined to develop Alzheimer's disease. So I know there are different hospitals and places where people can go get genetic tested, but keep in mind that that doesn't necessarily mean that you're going to develop Alzheimer's disease yourself.
Yeah. For the general public, Dr. Modlin, what's the test consist of? Because a guy like me or John or Bill doesn't know. They hear test, they get scared. Mm-hmm. So what would a test be like? Is that like a mental challenge? Test?
Well, Mike, blood testing.
Okay, Mike, you better serve.
Well, yeah. So really, up until recently, the one way to test it is just taking a cognitive test with a neurologist. And obviously there's some subjectivity to that, right? Spinal fluid, which is obviously a big ordeal. We're right on the cusp. We're not quite there, but we're right on the cusp of having a simple blood test. Yeah. And that's going to be huge. That's going to be huge because we really haven't had anything direct like that before. Unfortunately, if you go back a number of years, it's an autopsy, which obviously it's not very helpful, at that point, right? So, part of the research is, let's get a reliable blood test so that we're able to test people. But right now, since that's not quite released, a lot of times it's just sitting down and doing a test on paper with a neurologist and then making a judgment. So we need to do better than that, obviously.
Yeah, because granddad hears spinal test. He's like, I ain't getting no spinal test.
No. I'm out. Yeah.
So can you give that number for the Alzheimer's Association again? How can people contact you?
Yeah, it's 800-272-3900. And then there's also alz.org is the website. Lots of resources there as well. And I would just encourage people, even if you don't know, even if you just suspect maybe possibly there's something going on, give that number a call. You'll get the help you need. Don't hesitate. Reach out.
So speaking about, I mentioned, genes in Alzheimer's disease. In most cases, Alzheimer's does not have a single genetic cause. It can be influenced by multiple genes in combination with lifestyle, environmental factors. Consequently, a person may carry more than one genetic variant or group of variants that can either increase or reduce the risk of Alzheimer's. Again, people who develop Alzheimer's do not always have a history of the disease in their families. Again, different genetic variants that can affect Alzheimer's disease risk. They said in 2010, research showed that there were just 10 genetic areas associated with Alzheimer's. And today, now they understand that there's at least 80 genetic areas associated with the disease. So again, as Mike said, there's no one way in which to diagnose, the likelihood that a given individual is going to develop Alzheimer's disease by genetic testing. It says one well-known gene that influences Alzheimer's risk is the apolipoprotein E, or ApoE. It's involved in making a protein that can carry cholesterol and other types of fat in the blood. So yeah, I mean, there's a lot going on, and it just underscores what Mike was talking about, that we need more research, ongoing research. So, we call ourselves Music and Medicine. At the end of the show, we're going to play a very special song. It's called "Remember Me." It's I think the Alzheimer's Association considers it the anthem. We're going to play that at the end of the show, so we want people to stick around. At this point, I want to pivot just for 1 second, and in honor of my father, I want to play this short 5-minute video depicting my father and his situation with the Alzheimer's. So Russell's going to go ahead and play that now.
All right.
It was a gradual and progressive situation where I became the caregiver of my father. He was given a diagnosis probably about 1.5 years ago of Alzheimer's dementia. And it was something that we recognized over, a long period of time, that he was becoming more and more forgetful. And so when they actually put a diagnosis on the situation, it was kind of a shocking revelation. Alzheimer's dementia actually is a progressive disease. Although it can be controlled with medications, there's different degrees of severity. And my father, probably about 1 year ago, seemed to be in a more severe state than he actually is now. He suffered from, some anxiety, a lot of fears, and just especially fear of being alone. As a child, you never really know exactly when that transition is going to come. It's not inevitable, but in terms of making that transition from being child to caregiver, it was really just second nature that was something that I had to do as my responsibility.
Thank you. We're real proud of you. Thank you, man.
My father has been living with me probably for the last 2 years. He's expressed the fact that he feels much more comfortable and better actually just being, in the environment of his family, as opposed to trying to live on his own. It's really been a blessing for me to be able to see, that he's doing well. He's capable of doing a lot of the activities that he did before. He's capable of continuing to participate in his senior athletics. He's the current national record holder in 4 track and field events for the National Senior Games Association. He set national records for the 100-meter, 200-meter, 400-meter, and the long jump. So he's able to get back into those activities and participate. I'm just actually happy that he's out there competing. I'm proud to see him do that. There aren't many 84-year-olds that can actually, do what he does.
Good running there, young man. Thank you. Good work.
Obviously, we're not happy that he wasn't able to live on his own and that he's developed some forgetfulness. But at the same time, he's there with us physically every day. So, if you look on the positive side, there's always a positive side to every situation.
Yeah, thank you, Russell, for showing that video. I always get very emotional when I see that.
Incredible.
And
Yes.
I'll tell you a story. So that was filmed at Stanford University's campus in 2009. My father passed in 2010, but Humana actually recorded that little video segment. They saw my father had been struggling a little bit. They called us in. That was not rehearsed. That was a spontaneous interview that I did. But the interesting story about that video is I forgot all about that. I'd never seen that video probably for over 10 years. I never even once saw it.
Wow.
and I was searching my name on the internet about some articles and videos and things, and that video popped up. I didn't even know that video existed. So
Yeah.
I think that was a message from my father to me from beyond that I needed to get involved with this Alzheimer's Association. I mean, I honestly believe that.
Yeah.
He's been my inspiration. He continues to be my inspiration. But I think this is a very important topic. I think we've given out some critically important information. And again, our message was also to the caregivers that help is available. You're not alone. Anything else? Any other information we need to disseminate? Have we missed anything that we need to disseminate out to the community? We have the phone number and the website scrolling on the bottom there.
Yeah, I think we've covered it all. As mentioned on the website, you get into all kinds of detailed resources that are available, and the phone number is 24/7. Reach out anytime, but I think we've covered all the basics. I appreciate the opportunity to talk to both of you. It's been a great opportunity. Thank you.
No, thank you for being with us. And then, Jerome, any parting words or anything?
It's always to the public. If you or any of your family members you feel are starting to be affected by this disease, just reach out. Don't be scared. That's the whole thing. If we don't know about the problem, then we can't help with the issue. So just be brave enough and stand up for your family, because it's better for everyone. If you feel something, reach out to the right people.
Okay. Thank you very much, both of you. And we're going to we don't want people to leave, because we're going to close out again, as I said, with some very important informational videos about what are some of the 10 signs. I read through that, but they're going to give you more detailed information. How can you prevent Alzheimer's disease, and more information about what is Alzheimer's. So stay. Don't leave the program just yet. Also, we'd like you to like, share, and pass this information about music and medicine, this particular program. You can go back to Spotify and listen to previous programs. You go to our YouTube channel, Facebook, and other social media platforms to hear about this information that we've been disseminating over the past several years on music and medicine. So thank you all for being here. And then we're going to let Jerome, or actually Russell Johnson, take over and show these other educational videos. So thanks everybody for tuning in.
Till next time.
Okay, thank you.
Take care.
I need someone to hold on for me, to what I can't seem to hold on to. The life we used to live is slipping through my fingertips like a thread that's unraveling. I suppose that nothing lasts forever, and everything is lost in its time. When I can't find the words that I'm trying to speak, when I don't know the face in the mirror I see, when I feel I'm forgotten and lost in this world, won't you please remember me? Remember me. I know there'll come a day when I have gone away, and the memory of me will fade. But darling, think of me and who I used to be, and I'll be right there with you again. I hope I'm one thing worth not forgetting. Tell me that you'll never let me go. When I can't find the words that tell me that you'll never let me go. When I can't find the words that I'm trying to speak, when I don't know the face in the mirror I see, when I feel like I'm lost and alone in this world, won't you please remember me?
Beautiful. That was beautiful. Touching, very touching. God bless you guys.
Yes, awesome. Thank you.
People tend to confuse Alzheimer's disease with normal aging a whole lot, and that can be pretty dangerous because there are a lot of tools that are available for Alzheimer's disease that people aren't aware of. And when they have those tools, they're better able to manage the symptoms and all the different things that come as a result of Alzheimer's disease. We talk about 10 signs that are warning signs for Alzheimer's disease. The first one we talk about is memory loss that disrupts daily life. Memory loss is one of the first things people tend to recognize. They'll be repeating a lot of questions. They're not developing their short-term memory as well. With regular aging, it can be something as simple as forgetting someone's name once in a while, forgetting an appointment once in a while, but able to remember it later on. Number 2, challenges in planning or solving problems. If they have plans, especially if they're still working, they have a much harder time if they have dementia going through their plans. You know, occasionally we have a hard time as we age, but it's a lot more challenging when it comes to dementia or Alzheimer's disease. Number 3, difficulty completing familiar tasks. A person who's been making the same, pot pie for years and years and years, decades, suddenly she doesn't remember how to make it anymore. And this was something that was second nature to her. That's usually not as big an issue for somebody with regular aging. Another one, number 4, is confusion with time or place. They might start thinking that it's June when it's actually the middle of December, or completely forget what decade it is. Often what we see with Alzheimer's disease is that they start thinking that they're back into their 20s or 30s, and they expect to have like a younger husband and young children, and not the adult grown children that they have now. This is not really something that we tend to see with regular aging. Number 5, trouble understanding visual images or spatial relationships. So this is one of the reasons why when somebody has Alzheimer's disease, they have a harder time with driving because they're not able to tell how far something is as much, and they're more risk of getting into accidents. When it comes to driving for regular aging, occasionally there can be a little error here and there, maybe accidentally swipe your car, but this is something that's a lot more consistent. Number 6, new problems with words in speaking or writing. Something like simple that you have like a watch, starting to call it hand clock because they can't remember what the actual word is. With regular aging, you might forget a word here and there, but usually you're able to recall it. Misplacing things and losing the ability to retrace step. This is the 7th one, and this is where a lot of suspicion and accusations can occur with somebody who has dementia or Alzheimer's disease. that can cause a lot of problems within families, especially if they haven't been diagnosed. You know, with regular aging, occasionally we might put things in the wrong place, just being a little absent-minded, but we're able to recognize that, oh, I just misplaced it. Number 8, decreased or poor judgment. There've been cases where people were just writing checks away, falling for telemarketers, deciding that whatever was on the infomercial was something that they really needed and everybody around them needed. With regular aging, usually you're able to recover from it. You're able to recognize that, oh, this was a mistake. 9, withdrawal from work or social activities. It's a lot more difficult for someone with Alzheimer's disease to actually be around social gatherings or even be working anymore. They have a harder time following conversations, they can't really understand what's happening, and so they tend to withdraw from those situations. And lastly, changes in moods and personalities. We can only imagine all the things that they might be experiencing. We might see a lot of depression, anxiety, frustration, anger, and all these things can be overwhelming for them. With aging, this might happen once in a while as well, but it's not as drastic. And if even 1 or 2 or 3 of the symptoms that I've talked about are resonating with you, you know yourself best, and that's why we want you to do some self-reflection and figure out what you think is best, and always talk to your doctor. We have a really great resource, which is our 24/7 helpline. It's 1-800-272-3900, and our website, alz.org.
Around the world, tens of millions of people have Alzheimer's disease, a debilitating brain disorder that gradually destroys a person's memory and other cognitive abilities. It takes a heavy toll on both patients and families, as caring for a loved one with Alzheimer's can be emotionally overwhelming and financially difficult. While doctors have studied Alzheimer's for decades, conducting hundreds of clinical trials, there is still no effective preventive treatment or cure. So why is Alzheimer's disease so difficult to treat? Alzheimer's accounts for 60 to 80% of all dementia patients worldwide. Dementia is a broader term used to describe a variety of conditions that affect a patient's memory, thinking skills, and everyday functions. Most Alzheimer's patients first notice symptoms in their 60s, experiencing mild memory problems, like losing track of dates or forgetting what they just learned. Some experience other changes, like frequent shifts in mood, increased anxiety and agitation, and problems with coping in new situations. Symptoms typically progress gradually over years, and eventually a person with Alzheimer's may require constant care. Some rare forms of Alzheimer's are caused by a single inherited gene variant, but most of the time, Alzheimer's is due to the complex interaction of multiple genes in combination with lifestyle and environmental factors. So it's impossible to predict who will develop the disease. Alzheimer's involves a long chronic process, resulting in many changes to the brain that likely starts to unfold at least 1 to 2 decades before symptoms first appear.